You haven't thought this through. That table might be a little much for you to lift correctly all by yourself.
Hey, down here! Don't listen to La boy. This thing is easy peasy to lift. And you're buff. Either way, you don't have to move it that far.
He's right, you are a strapping fellow. But before you lift this on your own, consider this.
Consider nothing. Just lift it.
Well, mister, your performance on the hasn't been that crash hot lately, and even a little back niggle won't help your cause.
Just lift it.
No, seriously. Back injuries cause all sorts of problems.
Just lift it.
Your golf swing.
He doesn't even play golf. Lift it. All right. It doesn't look that heavy. I can lift this. Besides, I only have to move it 3 aisles. I've seen other blokes do it before. Then again, I don't like the sound of all that other stuff. Back pain, performance. Golf. Maybe. Are you right there? Yeah, fine.
Do you want a hand?
Yeah, that'd be great.
Whether you're a labourer on a construction site, work in a factory, a nurse, waiter or office worker, we're all exposed to the risk of manual handling injury at some time. Because, by definition, manual handling means using your body to exert force in order to handle, support or restrain any object. This includes people and animals. Manual tasks can lead to injury through the development of what are known as musculoskeletal disorders, or MSDs. MSDs account for close to half of all compensated workplace injuries, which runs into the tens of thousands every year. So what are MSDs? They are muscular sprains and strains, back injuries, RSI or repetitive strain injuries, soft tissue injuries to wrists, arms, shoulders, the neck or legs, and abdominal hernias. But forget the technical terms. It's what these injuries could mean to your everyday life that you should be more concerned about. With a back injury, everyday activities can become an excruciating ordeal. Simple things you take for granted, like walking, playing with kids, tying up your shoelaces, and yes, even... So here's a few simple guidelines to follow when a lift is necessary. Check the path to ensure that it is clear from obstructions and trip or slip hazards. Assess the lift, the condition of the load, the weight of the load, and is the load balanced and stable. Position yourself for the lift. Keep your feet shoulder width apart. And centre yourself over the load. Use correct lifting techniques and keep your back straight, bend your knees and squat down for the lift. Get a good grip and keep the load as close as possible to your body. Don't twist with the load. Change direction with your feet, not your torso.
Immediately after the video finishes, this DVD menu will appear. Select Toolbox Summary and each of the following screens are activated with a press of the OK button on your DVD remote control, or mouse click if you're playing from a PC. With the purchase of your DVD package, you will receive trainer support notes. In them, you are given numerous ideas to prompt discussion on each of these points.